Sometimes you feel like you're closing on your house after you get all those papers. And it really impacts in a negative way the patient experience.
Welcome to Revenue Cycle Above the Bottom Line, the podcast where we dive deep into the world of revenue cycle management. I'm your host, Tim Reiner, and in each episode, we sit down with industry leaders, innovators, and experts to explore challenges and strategies shaping the future of healthcare revenue cycle. Whether you're a seasoned professional or just starting out in the field, this podcast is your space for thought-provoking conversations, actionable career learnings, and discussions about the latest trends you need to know about. Thanks for tuning in, and let's get started. Today, I'm joined by Susana Molina, Director of Public Policy at AdventHealth. Susana brings deep experience in navigating the complex landscape of regulatory and governmental programs in nonprofit healthcare systems. In this episode, we'll explore how these programs influence our organization's mission and overall financial stability. Susana, thank you for being here with me today.
Thank you so much. It's a pleasure.
Share a little bit about your current role and responsibilities in that area.
I serve as Director of Public Policy for AdventHealth, and our team is responsible for monitoring the different policies that are coming from the federal government. So we track those different policy changes. We make sure that we're developing policy positions on behalf of the system. And then we also track state policies to determine what trends are taking place across the different states in which AdventHealth has a presence.
How many states does that mean you have to track, like 9 or 10?
We have to track policies across 10 different states. We work very closely with other departments within our larger advocacy team while doing that. And again, while we do specialize in federal policy, we have to look at those commonalities and differences in policies that are emerging in the state labs of legislation.
So how did you end up in that career path? Give me kind of the origin story of Susana.
When I was working with a congressman when the Affordable Care Act was being discussed. And to me, that ignited my curiosity in healthcare, and I wanted to learn more. It was such a complex piece of legislation that requires so many changes, and it was just fascinating to learn about the complexity of healthcare.
I want to spend some time talking about like the public policy side of healthcare and regulations as it applies to revenue cycle, which is my area of expertise. You worked in both of those settings, both local and federal government space. Like, how has that expertise kind of shaped your current role?
It helps tremendously. It really allows me to become more appreciative of the different points of views and the different perspectives. When you work in the public sector, you are the recipient of so many different opinions and perspectives about different policy issues. So when you become more familiarized and more receptive of those different opinions, it allows you to look at a policy from different sides and to challenge your assumption.
What are some of the policy and regulatory updates in that space that are coming out of either the Big Beautiful Bill or some of the other areas of prior auth?
Yes, so prior authorization, it's an issue that we know is not going away. In fact, traditional Medicare may start using it more. An example of that is the WISER model. It's a new model that got announced recently in which about 12 different services are going to be subject to prior authorization in traditional Medicare across different states, including Texas. So that's something that the federal government is looking at. Now, there is a growing recognition at both the federal and state level that prior authorization is being overutilized. So they want to fix that. And even though the pledge that health insurance made was a welcome step, there's an opportunity to continue to track that and see if the prior authorization process is indeed improved and we can see changes that increase access to care for our patients and that reduce that administrative burden on providers.
specific to Medicare Advantage, there was supposed to be in 2026 some prior authorization requirements too. So is it your sense that those will be delayed somewhat by some of these other models?
We're not hearing that the final rules impacting Medicare Advantage and the adoption of prior authorization, that those rules will be delayed. We haven't heard that yet. But I do think that soon we should be seeing the automation of the prior authorization processes. One of the statements that Dr. Oz from the Centers for Medicare and Medicaid Services made is either you fix it or we will.
Yeah.
So that's something that the Department of Health and Human Service and the Centers for Medicare and Medicaid Service will be looking at.
Yeah.
We do expect those rules to be implemented in 2026. I think the trick is going to be developing that automated process for insurers to use as well as providers.
You have to keep up with this so much. What kind of publications would you recommend somebody like me read to be able to keep up with both, state and federal level policy changes?
Well, we love Becker's. I think Modern Healthcare, it's a great publication as well. We follow The Hill and Politico quite a bit as well, just because to get a kind of like a flavor of what are some of the political discussions that are happening around these issues.
Before we continue, we wanted to thank you for tuning in. If you have questions or thoughts or just want to say hi, we'd love to hear from you. Send us an email at revcyclepodcast@adventhealth.com. That is REVCYCLE podcast@adventhealth.com. If you enjoyed this episode so far, be sure to like, subscribe, or follow so you never miss a new episode release. Now, let's get back to the rest of the episode. I want to go back to one topic of the medical debt. North Carolina had some elements of a waiver program for their Medicaid, their HASP program, HASP, and that created a bunch of medical debt forgiveness going back to 2014 for any patient in North Carolina. Give me the rundown of what other states might be doing similar kind of projects, and what do we see in that kind of medical debt area of advocacy? Each
state is addressing medical debt differently. You have states like North Carolina that are addressing medical debt to a Section 1115 waiver that needs to be approved by the Centers for Medicare and Medicaid Services and applies to the entirety of the state, impacting also provider reimbursements for providers that participate in Medicaid. You also have other states that are taking a more local approach. It's the county governments, the ones that are proposing different solutions to address medical debt. Here in Florida, Orange County is an example of that. So we are seeing initiatives both at the county level, at the local level, and then also more of the North Carolina broad state initiatives. I think that we're going to continue to see a mix of those two type of initiatives. We haven't heard yet about what the Centers for Medicare and Medicaid Service plans to do, if they're going to be, as an example, approving more Section 1115 waivers similar to the one that North Carolina has.
Let's talk a little bit about some of the cost containment items. What other cost containment policies do you expect to see more in the next 3 to 5 years?
Side neutral payments is a policy that is getting a lot of attention both at the federal and state level. Side neutral payments, as you know, is paying the same for the service regardless of what setting you're getting that service from. That policy, we're seeing it in Texas, we're seeing it in Colorado, we're seeing it emerge in different states that are proposing their own side neutral policies. And then we also know that Congress is looking at the potential of adopting side neutral payments for drug administration services. So we are likely going to see more policies on that pertaining to side neutral. Another policy that is starting to emerge as well is the elimination of facility fees. So when a patient receives a service in the outpatient setting, there's a facility fee that is charged that it's different from when that patient receives care in a physician office. Some states are looking to eliminate that facility fee either for all outpatient services or at least for some. So we were seeing different approaches Some states are looking to eliminate the facility fee for telehealth services specifically, and others are for the whole products of outpatient services.
The Trump administration probably wants to reduce the regulatory burden, different than the prior administration. What opportunities do you think they'll focus on in today's environment to kind of deregulate or reduce the administrative burden?
Yeah, so there was an executive order that President Trump signed that required all federal agencies to eliminate 10 regulations or guidances every time that a new regulation is issued. So at AdventHealth, we have come up with a list of different deregulation ideas that that the administration could consider. One example is looking at the vast amount of Medicare notices that are currently required to provide to patients. So we all been in the hospital before. When you come to a hospital, sometimes you feel like you're closing on your house after you get all those papers. And it really impacts in a negative way the patient experience. So we think that it would be good for CMS and the Department of Health and Human Services to look at those notices and see if there are opportunities to streamline them or merge at least some of those notices.
Congress passed the One Big Beautiful Bill. What actions do we expect by the end of the year, kind of in the short term, that comes out of that?
So a lot of the provisions of the One Big Beautiful Bill will take effect beginning in 2027, actually. But there is the expiration of the ACA's enhanced subsidies. These are subsidies that individuals get by purchasing coverage in the Affordable Care Act, Obamacare marketplaces. So funding for those marketplace subsidies has not been reauthorized, which will impact people that are currently getting those premiums through the marketplace. And that has the potential of increasing the number of uninsured.
Absolutely.
And increasing hospitals uncompensated care.
What can leaders do to kind of address some of that uncertainty?
One is work with your government advocacy leaders to ensure that you are familiarized with the changes that are coming down the pipe. I would say second, ensure that you are already tracking the data that you need to be tracking to model some of the impact of these policies. That's very important. And then for us who are speaking to policymakers, it's important to have that information and have those stories so that we can relay them and help inform policy. Data is gold in today's environment, so I think like making sure that you have the metrics and the data needed to demonstrate the impact will be very important.
As you know, we're on a journey to become more of a world-class revenue cycle organization, on the way to preeminent. What does that mean in the policy and advocacy space? Like, how can you kind of instantiate your teams to be preeminent or world-class?
Because of what we've talked, there's a lot of pressures that are coming down our way, and there's a need to develop solutions that align with the goals of reducing healthcare costs. So it's just thinking outside of the box, looking at tools like AI, virtual care, that allows us to improve those efficiencies, and then also improve access to care, make it easier.
So we've had a chance to talk about a lot today. What key takeaway would you kind of like to leave with the audience with from kind of your area of expertise?
Yeah, so I think like one key thing is to understand that there's a lot of financial pressures. Our payer mix is changing. We have an unprecedented number of seniors that are shifting from commercial insurance to now Medicare. And that payer mix is also going to be impacted by the changes that we're seeing at the federal and at state level. And with all those challenges coming in, they're not going to change. So we have to be nimble. We have to be innovative. We have to look for solutions so that we can continue to remain financially viable and that we can continue to fulfill our promise.
especially in growth states like some of the ones we're in Florida and Texas, there's just going to be more Medicare age patients over the next 10 years. And that's going to be important that we have the models in place to serve both, traditional Medicare and Medicare Advantage. Do you see that continuing to grow? It does seem like, Medicare Advantage has been growing, although maybe under a little bit of financial pressure. So like, what is the politics around that?
So Medicare Advantage, I believe more than 50% of Medicare beneficiaries are enrolled in a Medicare Advantage plan. And similar with Medicaid, most beneficiaries in a lot of the states are now in managed care.
Yeah.
So we are seeing that grow. We don't think it's going to change. And that's also the reason why we have the Centers of Medicare and Medicaid Service, as well as Congress, looking at what changes could we make within those spaces. Prior authorization is an example of that, to improve the experience for patients and also to make it easier to reduce that burden for providers.
Before we wrap up, we asked our previous guest to ask a question to you. So that question was, what is your favorite candy bar?
Great question. I would say Kit Kat. What's your favorite?
I'm more of a gummy candy guy,
Okay,
so like
I see that.
it would be like the trolleys, like sour worms or something like that, or gummy bears,
Okay.
like that kind of stuff. But thanks so much for joining me today,
Thank
and
you
I've really
so much.
enjoyed our conversation.
Yes, thank you so much. I really appreciate it.
Thank you so much for tuning in to today's episode. Please make sure to like and subscribe to be notified when our next episode drops.